Despite continuing signs of progress, the numbers for Boston show a stubborn racial gap in the health of young children and their mothers. Our guests examined that experience in a documentary film that focused on three black mothers from Dorchester and Jamaica Plain. Joining us is the person who conceived the film as part of her graduate work at Boston University, Fatima Dainkeh, currently the Racial Justice Senior Coordinator at YWCA Boston. Also with us is the film's co-producer and a doctoral candidate at the Harvard T.H. Chan School of Public Health, Tariana Little. Thank you both very much for being with us.
Thank you, Chris.
Thank you.
I want to start with Fatima. This was, at the outset, your idea. So what got you going on it?
Absolutely. So as a master student, when I was sitting in the classroom, one of my focus area was maternal and child health. And a lot of times when you're sitting in the classroom, we go over data that talks about the health inequities, specifically in the Black community. And when we listen to that data, what we hear is Black mothers and their babies are dying, regardless of their education level or their socioeconomic status. So of course, as a Black woman and someone who potentially may want to have children, it's very disheartening to hear that in the classroom. And I also knew that the research wasn't necessarily giving us all that we wanted. So I wanted to hear the stories behind those numbers and sort of hearing what does the protective and risk factors actually look like for Black mothers.
Now, one of the things that I had certainly heard before was that this is the thing that affected Black women of all economic levels, and yet I'm listening to the mothers in this film. They sound like people who have a lot of education. They're really focused on their child's well-being, and they know their way around, and yet what are they telling you in these stories?
So I mean, the women that we interviewed they were in the video, they come from various backgrounds, socioeconomic status, different education level. And I think part of it is that as a Black mother, you just become aware of a lot of those things. A lot of things that you might have not thought about before. Once you have a child, you start realizing how race and all these other social identities affect the livelihood of Black mothers. And so the people that were on the video, what they're telling us, they're saying the stats that you're reading are true, and let me tell you what that looks like in my day-to-day life.
So, Tariana, you also have background in video production, and I guess one of the things you had to do here was get the women in this film to talk about something that's most people don't usually talk about in public. How did you get them to open up?
Once I saw what Fatima was doing, it was an immediate match, and we found that once we put the call for interviews out there, we got a lot of responses, and it actually was not difficult getting women to solicit their stories. In fact, these are stories that people share every day in their communities, in their families, with their girlfriends, with their loved ones. And so we were just a trusted, supportive platform that enabled them to share their stories publicly.
Now, one of the things that you're keying on in this project is the power of storytelling. What does that mean exactly?
For us, what that means is that we need to look at lives beyond the numbers, as Fatima said, and look at the lived experience as evidence enough. There are things that we learn in the classroom or read in the newspaper, like the Boston Globe series, and we wanted to take it a little further. And what does it look like when we focus a little bit more on the humanity, on the struggles, on the triumphs, on the beauty that families are facing? And so how do we leverage storytelling and video and digital media as a way to shed light to that?
Fatima, one of the people you talked to was a mother who gives birth. She's taken care of by white nurses, doesn't see any person of color, and all of a sudden she deals with the obstetrician who is a person of color. And talk about what was the difference for her?
The mother on that film, she's amazing, just working with her. And when we talked about that story, it was amazing to see how even though she was getting care, it was not the care that she needed at the moment. And she is very aware of the inequities that exist. So before even conceiving of a child and going through that process, she was aware that she was at a higher risk than her white counterparts of having possibly a low-term birth weight or her possibly even dying during birth. And so she wanted people who understood that and could help her in that room.
And we're going to show you that clip in just a moment here.
Going back and forth with all of the nurses. One of them came in and was like, saw my husband and was like, oh, she's gonna have beautiful curly hair. And I was just like, oh, I don't want her again, and just, I was banning nurses left and right. It was my only saving grace was that my OBGYN was Black and understood. she understood that I was under more stress than the other white people women that were on the floor. She understood that I needed injections of blackness. She came by with poems and songs, and she just sat and talked with me. There is something really powerful about a well-placed girl. Like, that is, as soon as she said that, I was like, oh, okay. I'm in a space that, like, I can be all of me, right?
Tariana, Fatima mentioned what a woman needs at that moment. I know there are clinical answers to that kind of question, but what else does she need?
So in the clip, when she said she needed injections of blackness, what that meant, at least from what we understood, is that she needed a presence of someone who reflected her and understood that even though she was a mother and was in this hospital and receiving the best care possible, still there were experiences that she was bringing into the healthcare system and receiving from the healthcare system. So having a provider that looks like her, that understands that she's at a heightened stress level, being one of the few, if not only, Black mothers in that ward, that injection of blackness, the poetry, the singing, the support is what I believe helped her have a better experience in that healthcare setting.
But anyway, I guess the other thing that your film unpacks here is when people know that they're being perceived as a stereotype as opposed to who they actually are. How did you pick that up in the film?
I think specifically in the film, when we did the film, we did not want to tell women what to say. We went to them and we said, here's what we're interested in doing, tell your story. And as you will see, perception does equal reality. And it's not just because people are making these things up, but we see day in and day out how racial discrimination in all arenas, especially in the healthcare system, specifically bias, a lot of that is unconscious, can affect the way people feel and can affect the way that their service is being provided, whether that's from the healthcare provider or from the woman actually receiving the service.
Tariana, it also makes me think of part of the Globe series earlier on about how there were certain hospitals where people of color went to a lot and others where they hardly went at all. And we don't know whether it's because of how comfortable they felt or if there were some other reasons. Do you see a connection between that and what you're picking up from the women in this film?
Yes, I think that there is sometimes a choice in where do I go to seek care? Do I go to a place that's in my neighborhood that is easily accessible to me and that I know that when I go there, there's going to be a lot more people that look like me and that I am not going to be physically different, that I'm not going to be obviously different. And so in this story, we have two examples of what does it look like when you are physically different? We have one mother who talks about going in and perceiving discrimination based on health insurance status, perhaps being a single mother, being low income and being Black. So you have the intersectionality of those identities. And the other one talking about, I am a Black mother at a higher risk. And so you have, the film touches on different experiences, the different layers of difference that can emerge and how healthcare settings need to be attuned to that.
Fatima, we've been mainly doing a social justice diagnosis of the women in the film, but when you experience what they've been going through, it also causes stress, doesn't it?
Absolutely. And so as a public health student, both of us, one thing that you learn, fancy word maybe for some, cortisol levels. And what research shows is that for Black people, especially Black women, there's a fight response that all of us have. And a lot of times people who are living in situations where either in a low income neighborhood or they're racially discriminated against, that flight response is usually at a higher level. And so your cortisol levels are really high. And so going back to the question about perception, if I perceive that someone is racially biased to me, then that reacts to my body. I'm releasing hormones, my stress levels are high. And it's important to think about this through a life course model, which is a term we use in public health, which means the racism that usually occurs is not necessarily something inflicted on a personal level. It starts from a system, right? So from the beginning of birth all the way out until you're no longer here. And so what these women are facing, it's not just when they get into the hospital, when they're pregnant. It's something that they're facing in the beginning of birth, during birth, and after, and we see that in the video as well.
Tariana, when you think of science as the impersonal and the aggregate, In this film, you're talking about personal and you're talking about anecdotal. What about the importance of that, the anecdotal and the personal?
We definitely believe that lived experience is evidence enough, and that goes with the power of storytelling. We really wanted to make sure that these women felt comfortable, that their stories were centralized and humanized, and that we were telling who they were in a way that was not filtered. There was no agenda, really was guided questions, and they talk about a lot more than we can potentially include in the film. But our point was to say your lived experience is enough, and we hear you, and we are just asking the questions, and we have a camera and a platform to tell your story.
And you also have a place where people can see this too, right?
Yes. You can visit www.em.vision/community.
Thank you very much, Tariana Little and Fatima Dainkeh.